Uh, Assalamu alaikum. I'm Dr. Sadia. Today we'll discuss a very important topic, that is the anatomy of the middle ear. So, regarding to the middle ear, it starts from the tympanic membrane, and it is a narrow and tympanic membrane or the eardrum, which is forming the lateral wall of the tympanic cavity. So this is a tympanic membrane, and this actually separates the external ear from the middle ear. So this is a demarcation, or this is a wall, and which is tympanic membrane. So beta, this is a tympanic membrane which actually separates the external layer from the middle layer, and the middle layer is actually a narrow oblique slit-like cavity, and it is a air-filled cavity. अच्छा, कहाँ से आती है air? The air is coming through the nasopharynx, through the pharyngotympanic tube from the nasopharynx, because this pharyngotympanic tube, which is entering into the middle ear cavity, that actually uh, uh, gets the air from the nasopharynx, and then it passes to the middle ear cavity, and its function is to balance the air between the nasopharynx and the middle ear cavity. So it is an air filled cavity, and it is lined by the mucous membrane. It is a narrow slit like oblique air-filled cavity, and it contains the ossicles. It receives the nasopharynx. It opens into the जो है आपका mastoid antrum. So we'll talk each and everything in detail. Okay. So this is a tympanic membrane, which is very important. It is actually a bridge between the external ear and the internal ear. The sound wave which collects by the external ear pinna and the external auditory canal, it is strikes over the tympanic membrane, and the function of the tympanic membrane is transferred. It transfers the sound waves to the ossicles, and from the ossicles via the stapes, it hits the sound waves, hits the perilymph, and then creates the or transmits the sound waves to the internal ear. So this is the mechanism actually. So whatever whenever the tympanic membrane vibrates, it causes the vibration in the ossicles, and then ossicles transmits the sound waves. So this is an oval window. An oval window, it is called the fenestra vestibuli, and through this oval window, when it opens into the scala vestibuli, the opening is called fenestra vestibuli or the oval window, and it opens into a perilymph of the scala vestibuli. Here is another opening. This is called a round window. It is lined by the secondary tympanic membrane, and it is called the scala. It opens into a scala tympani, and that is the perilymph. Scala tympani is the perilymph, because the round window is connected with the perilymph of the scala tympani, and the oval window is connected with the perilymph of the scala vestibuli. And this is the fenestra cochlea. The other name of the round window is fenestra cochlea. So this is a narrow oblique slit like cavity, and it is an air filled cavity, and air is coming through from the nasopharynx through the auditory tube or eustachian tube into the middle ear cavity. So these are the ossicles. It contains the ossicles. This is the malleus, this is the inscus, this is the stapes, and these are the ossicles which actually gets the sound vibrations from the tympanic membrane, and then transmits it to the perilymph. ठीक है, when the scala vestibuli, a perilymph of the scala vestibuli becomes stimulated, it also stimulates and creates the vibration in the secondary tympanic membrane, which is the scala tympani and the fenestra cochlea. तो ये इसका नाम है, ठीक है, ओके। तो जब भी ये स्ट्राइक यहाँ से साउंड वेव स्ट्राइक करेंगी पेरिलिम्फ ऑफ द स्काला वेस्टिबुली ऑफ द इनर ईयर, तो वो पेरिलिम्फ फिर घूम के वापस आएगा, और ये सेकेंडरी टिम्पैनिक मेम्ब्रेन के अंदर वाइब्रेशन शुरू हो जाएंगी. So the scala, when the scala vestibuli is stimulated, then this stimulation comes through the scala tympani. ठीक है. So scala tympani it also contains the perilymph, and this is this जो आपका round window है, it is covered by a secondary tympanic membrane, or this round window is also called the fenestra cochlea. अच्छा, अब अब we will discuss in detail about the tympanic membrane. It is actually the tympanic cavity है, it is oblique, slit like and narrow cavity, and it is present in the long axis of the tympanic membrane. So this cavity is present in the long axis of the tympanic membrane. So now we'll study in detail the tympanic membrane. The tympanic membrane is actually uh, it is a trilaminar membrane. It has a outer covering which is outward of the, which is towards the external auditory meatus, and one an inner membrane, inner covering which is covered by the जो है simple cuboidal epithelium, and it is in the side of the middle ear cavity. So अगर आप यहाँ देखेंगे, so this is the outer layer and the inner layer. The outer layer is towards the external auditory meatus, and the inner ear towards the middle ear cavity. This outer layer is covered by the stratified squamous epithelium, and in between the and the inner layer is covered by the simple cuboidal epithelium. Between the simple cuboidal epithelium, which is the epithelium of the middle ear also, and the outer covering, that is the stratified squamous epithelium, we have a in between we have a fibrous layer also. This is called a trilaminar membrane, because it is covered by a outer side, it is covered by a stratified squamous, and the inner side it is covered by a simple cuboidal epithelium, and in between it is fibrous in nature. So we'll move forward. So this is like a tympanic membrane. It is a trilaminar membrane. It is concave. It is concave at the side of external auditory meatus, and it is convex towards the middle ear cavity. It is concave towards the external auditory meatus, and it is concave towards the middle ear cavity. So when we move forward, we'll see that this portion, that this is the handle of the malleus. This attached over the जो है inner side of the tympanic membrane. अगर आप देखेंगे, so this is the handle of the malleus. ठीक है, this is the head of the malleus. This is the uh, this is the आपका जो है lateral process of the malleus. This is the anterior process of the malleus. This is the handle of the malleus. So this handle of the malleus is attached over the tympanic membrane, over the convex side of the tympanic membrane. So the inner side of the membrane, which is actually towards the middle ear cavity, and the outer side is towards the external auditory canal. ठीक है, the outer side is concave, and inner side is convex, and over the convex side we have a attachment of the handle of the malleus. ठीक है बेटा, so this is the handle of the malleus, which is attached over the convex side of the tympanic membrane, which is the inner side of the tympanic membrane. ठीक है, and this is the pars tensa. This is the pars tensa. This tympanic membrane is placed obliquely, and it is directed downward, forward, and laterally. It is placed obliquely, so it is placed obliquely, and it is directed downward, forward, and laterally. It is separating the external ear from the internal ear. Okay, so we'll move forward. So this is the pars tensa. This is the area. This is called a pars tensa, and the pars tensa, जो है, it is formed the fibrocartilaginous ring around. This is a fibrocartilaginous ring which actually fits into the bony cavity, tympanic bony cavity. Acha, this middle ear cavity is present in the petrous part of the temporal bone. In which bone it is present? In the petrous part of the temporal bone. So it is present in the petrous part of the temporal bone. So this is the pars tensa, and the thickening of the pars tensa is called fibrocartilaginous ring. So most of the area of the tympanic membrane is called pars tensa, and these are the anterior malleolar fold and the posterior malleolar fold. These malleolar folds are attached to the lateral process of the malleus, and this is a loose and the slacken, loose, and the pink in color membrane. This is called a pars flaccida. This is called the pars flaccida, and this is called the pars tensa. So this pars flaccida is present over the or on the upper surface of the anterior and the posterior malleolar folds. ठीक है? अच्छा, okay. So the most convex part on the outer side, on the inner side of the tympanic membrane, is the tip of the malleus. This is called ombo. This is called tip of the malleus is called ombo. And when you put a light over the tympanic membrane, the light, the cone of light will produce, and this it is produced inferiorly over the tympanic membrane. So this illuminated area, which is called the cone of light, it is produced when you put a when you put an illumination over the at the area of ombo, that produce the light at antero inferiorly and forms the cone of light. So this is a cone of light. ठीक है? So the tympanic membrane is having a attachment of the handle of malleus. Anterior and posterior malleolar folds are present over the lateral process of the malleus, and the this is the Slackens membrane, loose and slackened membrane. This is called the pars flaccida. क्या होता है? Recording. ठीक है, हम करे बैठा हम रिकॉर्डिंग को ठीक, अपना दरवाजा वास्ते करना